Hello, I'm Nancy Zimney, the Canine Rehabilitation Therapist at Peak Veterinary Referral Center here in Williston, Vermont, here with Liz and her dog Harper, who are going to help us do a video today on how to do passive range of motion of the front limb of the dog. So, when you're doing passive range of motion, when you need to do passive range of motion of the dog, the exact handholds can vary. That depends on the size of your dog. Obviously, Harper is a really large dog, and it can also depend on the problem for which the dog needs passive range of motion. But certain basic principles still apply. You want to have the dog in as a relaxed position as possible. Usually that means being on their side, like Harper is here. It can be done in other positions, but it's certainly easier on you and probably easier to do the passive range for the dog as well if they're lying in their sideline position. You want to always support the limb so that there's no twisting or torquing as you go through these motions. And that usually means keeping the limb approximately parallel to the ground as you're moving the different joints through their range of motion. You also want to use comfortable handholds, not gripping them too tightly and moving slowly and not in a jerky kind of motion. And finally, you want to respect the normal range of motion of the joints as well as the dog's sensitivity to movement of the joints. And certainly never force a joint beyond the dog's willingness to move that joint. In the forward limb of the dog, there are three very visible joints. That is the shoulder, which my left hand is on right here, and the elbow, and the wrist, or carpal joint. And these are very visible because they're you're easily able to move those. However, I'm going to start first here with a joint that's not quite as movable, and that is the bone of the shoulder blade and its movement on the rib cage. And Harper's got a lot of fur here, so we really need to palpate to find it on him. And this is not a joint that's a normal joint or like the other joints because it doesn't have quite the characteristics of the other joints in the body. But it's still extremely important because there's several muscles that come from the neck area and that insert down into the shoulder area, as well as muscles that come from lower down on the spine and insert up here onto the shoulder blade. And the shoulder blade's ability to move on the rib cage is an important part of forward limb motion, and it can have influences on the dog's spine as well for those reasons. So in order to keep those muscles flexible and keep the dog able to move the front limb in the right way, we need to move that shoulder blade. In order to move it, you need to be able to find it first. And probably, there's a little picture of the shoulder blade right on top of Harper and his shoulder blade. This is a scapular or shoulder blade, same thing. And you can see that it's a large bone. And when we go to palpate it to find out where it is, we usually look for these corners, the back corner here, or the ridge over the top, or the front corner. Or another place we can pick it up is this ridge. You can follow my finger down here and up is a bony ridge that you can often palpate even in dogs who have a lot of fur on them. So that's how we can locate it so that we can try and start to move it. So to do that, we usually look for the top edges, front edge, and on Harper, he's a very muscular dog. Here, right at the front edge, and then I'll just follow that top around to the back edge. So I've got One thumb here on the front edge and one thumb back here on the back edge of his shoulder blade. And I can feel for that ridge on his shoulder blade as well, which is right here, and I'm just following it down. So you can put one hand, usually it's easiest, you think about the shoulder blade, it's easiest to think about it moving in a couple of ways. Forward towards the head and back towards the tail in this direction, or more or less up towards the spine and down towards the leg along the angle of that ridge that we just found. So we have to grab a hold of that shoulder blade, one hand on the top, the other hand right at the shoulder joint, and this, I'll just move it back down towards his tail and up towards his head and down. This is stretching a lot of those neck muscles, and then up. And you can see he's relaxing pretty nicely, so it's pretty mobile. There's a fair amount of motion of that shoulder blade on his rib cage. So that's the forward towards his head, back towards his tail motion, and then I can do the motion of going down towards his foot and back up towards his spine by pushing down this way, bend his shoulder a little bit, giving it a little more grip, and up towards me, down towards his leg, up towards me. And sometimes it's just more comfortable on the dog to even just do both of those together and just move it in some nice, slow, gentle circles. Like this. Okay. Now, once you've loosened up the shoulder blade and it's moving well on the rib cage, then we can do the other motions. And there's a quick and easy way to do the motions, sort of combine them, rather efficient, which is just sort of treating the limb as a little bit of an accordion and bending all the joints up into a flex position like this, and then bringing them all together simultaneously down into an extended position out straight. So bending at the shoulder, the elbow, and the wrist or carpal joint into flexion, and then straightening shoulder, elbow, wrist into full extension. His arm is longer than my arm. Okay. Bend up like an accordion, and then out straight for extension. And sometimes that might be sufficient if you're trying to do some passive range of motion with your dog, but let's take a look at just moving each one so we get each one of the joints separately so that we get the full motion of each joint. So starting at the shoulder joint, which is right here, that shoulder joint flexes. We're bringing this bone back towards the scapula so this motion is happening. And then it straightens out and extends, and you can see that we get a little bit more extension here than when we were doing at the shoulder, than when we were doing the accordion-like motion. So flexion at the shoulder and extension at the shoulder. And my hand holds here, I've got one hand hold under his elbow, pretty much holding the weight of his arm because his arm is pretty heavy, and the other hand on the front of that shoulder blade to keep it back so that I'm not just moving the shoulder blade up and down when I get this leg going. I hold the shoulder blade back towards me, and then by pushing on the elbow, bring the arm forward up towards his muzzle. So once again, flexion at the shoulder joint, bending, and extension. Flexion. And one more. And if you feel the dog dog's starting to resist, just like we did in the hind limb, you can just sort of jiggle them a little bit like this, and that often gets them to relax. Good job. There are other motions at the shoulder joint too. Sometimes doing just flexion extension will be sufficient. Talk to your rehab therapist or vet about which motions they want you to do. But in case you need to do a motion called abduction, or pulling the leg up away from the body, you first put the leg into some extension, like we just did. Hold one hand over the shoulder blade, and then fold the leg up away from the body and down. And it's called abduction, abduction, and down. Good job. Yeah. Very good. And there's also some rotation in the shoulder joint we may or may not have to do, but for this one, we have one hand hold on the elbow, one at the wrist. We can stabilize the scapula by leaning on it a little bit and turn the forearm in for internal rotation and out. And again, stay within the available range of the dog's willingness to let you move. You wouldn't want to be putting a lot of torque or twisting on this motion. Internal rotation and external rotation. So that's the shoulder joint. Next joint here is at the elbow joint, and that's pretty straightforward. We bend the elbow to come up into a bent position, fully flexed position, and straighten it. So flexion and extension. And again, if they pull back suddenly, just wait a second or give them a little jiggle, and they'll often let you keep going. And the final joint here at the wrist or carpal joint is the same thing, bending and straightening. So bending is flexion. We often do that with when I have the elbow bent, as I have Harper here. So we get full flexion of this carpal joint. And then to straighten it out into its full, you need to straighten the elbow and bring the wrist or carpal joint up into extension. So we sort of often combine that with the elbow because there's a synergy between those two motions. Extension, flexion, extension. And that is passive range of motion of the front limb. Of course, there are some other joints within the paw, the toe joints, but we're going to do those in a separate video at another time.